Thank you so much, the Nation Media and the participant for this summit. First is to thank the organizers of this conference, and the County Murang'a is very glad to participate. Secondly, is to say that technology is the way forward, that in this fourth industrial revolution, county governments have no choice but to take advantage of the advance in technology. We are aware of the fact that we must create efficient systems. We must make sure the county government are objective, and also automation ensures there is no corruption. It reduces incidents of corruption, and also the interaction between the mwananchi and governments become a little bit easier. Also, change is something you cannot stop. Long time ago, people used to travel using bicycles, but then vehicles were made through technology. Then thereafter, we now have people who travel by planes, and that is an example of how technology is something you cannot stop. So it's upon us who are in county government to take advantage of the advance in technology. We harness it. So in Murang'a, for instance, we have various flagship programs, and we have endeavored to automate those flagship programs. Allow me to mention some of those flagship programs. Number one, in healthcare, we have something that is called Kang'ata Care, which is basically a partnership between Murang'a County and the NHIF, where poor people access free medical services without paying. We give them a certain card, which is paid for by the county. So we have to automate that so that we are able to track whether there is corruption or not, or also whether our patients are benefiting or not. We have something called Murang'a Youth Service, which is basically a program where young people who have no jobs, we give them short work-study programs. They earn something, they clean our towns, then thereafter we take them to village polytechnics, they get skills, then thereafter we give them seed capital for free. Again, that program had to be automated so that we know whether they are attending the classes, whether they are actually cleaning our towns, and therefore automation has been very helpful in that program. Also, we have something called community projects, which is essentially a program intended to ensure the county developed in a manner that is equitable, and therefore each ward gets a certain amount of money for development, and through that program we have renovated ECDs. So you automate that program, for instance, so that you are able to track whether that development is happening or not. You supervise the execution of the building of those classes. Same way with our school feeding program, where we give 42,000 ECD learners every day free porridge. Again, we automated that system so that we know whether did our ECD pupils, the 42,000 of them, in a certain date, in a certain school, take that porridge. How many attended class? It also helps us to monitor the attendance of our ECD class, or of our ECD teachers. We have also the minimum guaranteed return for milk and mango. Again, we had to automate that to be able to know whether our farmers are delivering milk on a day-to-day basis, so that they now qualify to get the county government support, and also to check productivity of each farmer. We have other programs like what we call the Smart City program, which is improving infrastructure of our towns. But the most important program from where we see it that is going to ensure is not about the next 5 years. It's not about the re-election of our county government. It is ensuring the county government build blocks for posterity for 10, 20 years, or even 100 years, when we shall all be dead, is automation. That program has been very important because, one, It has helped Murang'a County government revenue to increase almost to double after we started to automate the revenue. Also in healthcare, we partnered with the Ministry of Health to automate patient journey. And therefore, in our 8 level 4 hospitals in Murang'a, when you go there, you don't carry a physical card. You just produce your ID, you are served. The entire patient journey is paperless. By a click of a button, you are able to know how many patients are let's say, in level 4 hospital in Murang'a. What diseases took them there? And is there medicine or not? And we are now rolling out that program in the entire 157 health facilities, that is dispensaries and also health centers. The other day, the government passed something called Facilities Improvement Fund, which is basically means hospital money will no longer go to the county treasury. It will be spent at source. But then the question arose, how do you then check and see whether the medical superintendent and the people at each facilities are doing a good job? So again, we had to automate that process, and we are happy within 1 month we were able to come up with a software where we are now able to know how each hospital is procuring, let's say, medicine, non-farm, lab reagents. We are able also now to give opportunities to tenderers not to physically bring documents to the county headquarters and lobby for work, but they only need to log in into a system and bid for various services. And again, that has hastened delivery of things in our hospitals, as opposed to where that was something that was centrally placed. Also, we have something called maternal support program. Although currently we have stopped it, but it is one of our key programs, which is we give certain cash incentives to mothers to come to and deliver children in public facilities, as opposed to delivering children at home. And therefore, we automated that process. It has helped us to know other problems that exist in our county, including teenage pregnancies. So at a click of a button, you can be able to know whether constituency X or even facility X, how many teenage mothers have gone there, and therefore we take remedial actions through technology. Of course, there are problems and challenges. Number one is downtime. Our systems are hosted in Nairobi at the Ministry of Health. Once in a blue moon, we experience downtime, and you know, particularly in healthcare, that's a life and death issue. Yeah, there have been instances where a surgery is happening, then the system collapses, yeah, when that thing is happening. So we are in collaboration with the Ministry of Health in Nairobi. We ensure that we host our services in clouds, or we get a better entity that can ensure that service is not interrupted, particularly the one on health. Secondly, there's also the problem of manpower. To develop those systems, you need very good software engineers. We are very glad with the team that is working for us. Most likely they would be employing their minds in the private sectors. That's where they have the money to pay software engineers. But what I've also realized is these young people who are coming out of our university, they are very versatile. Yeah, I think as governments, we really need to create employment for them, because if you don't give them an opportunity, they'll be the one hacking bank accounts in the forest. Yeah. So the other challenge is the cost, particularly in terms of procuring the gadgets. Yeah, you have to buy, number one, the network. You pay Safaricom quite a sum. Secondly, you have to buy the computers. You have to keep on maintaining those computers, and that has been, it requires us to do a lot of investments. Finally, something called change management. You have to convince the members of public, particularly the people of Murang'a, that please let us automate. And here you are talking of the old shushus who goes to the hospital seeking services. They are now being told, please don't come with your card. Just come up with your ID. Yeah? You are telling those shushus who go to the market to pay, don't pay in cash. Now you have to pay with the M-Pesa. Some of them really don't even have a phone. So that has been an issue. Also, our staff, for the longest of period, they have been using manual documents to convince them that now this is the way. You no longer have to do prescription in a medical card manually. You have not to use a system. Again, it requires a lot of conversations. And finally, there are people who are benefiting with the old status quo. So again, you really need a lot of political goodwill and political efforts to stamp your authority and to push. And finally, is also the idea of ensuring cybersecurity. Because at times we fear if there is a major attack on our systems, I think Murang'a will now definitely ground to a halt. Maybe for 2 minutes, maybe Bwana Meshak, you can come and just illustrate some of this together with the IT advisors. Come, we just show you one or two, the one for the health, because that has been very important. I know it will create so these are some of the people we work with in the county to develop some of these systems. We just show you for the one for the hospital. Yes, now, I don't know whether it can. Yeah, we start with the one for the revenue. Yeah, now this one is for the revenue. You can see as we stay here, we have 94 vehicles that are parked in Murang'a. They have given us 8,200. So far, the markets, the various hospitals. On the left, is a dashboard showing the various revenue sources, the parking, the market, the hospital, the quarry. Click in the next one. Again, this one is for a single business permit or liquor licenses. You can see how many people have applied so far, how many have been approved, single business permit, how much money we have collected. These are the sub-counties, that is municipality, Gatanga, all the way down there. You can see the kind of money we have gotten so far. We have another one called AFIA. This now is for the hospital. This one now is the one that enables us now to see what is happening in each facility. So far, we have 157. So you'll come here and click the patient register. You'll then choose a facility where you want to check. You can input your ID, and then you tell us the password. Then we look at a hospital. Yes. This is now the password we are inputting. Then now the hospital. Now you can post there. You can see we have Murang'a Referral Hospital, Muriranjas. Can you scroll down? Kandara, Kangema Sub-County, Kenneth Matiba, Kegumo, all the way to the facilities that we have. So we come to Murang'a, for instance. We want to know how many people are in Murang'a currently and what diseases has taken them there. So as we speak, we have 513 patients in Murang'a. On this other one, we have collected 58,000 Kenya shilling. Can you go there at M-Pesa and you check the various payment platforms? So for cash is 58,000. You can see how many have been waived. The county, those who have paid through NHIF, the Kang'ata care, how many, for instance? So far, we have gotten 10,000 using that county-funded NHIF program. Now, what about availability of medicine? You look at the prescription fulfillment. The red one there, the red. So far, 7 people went to the pharmacy. They did not get any drug. Yeah. The other one means unfulfilled. Again, they didn't get 14. The ones who got drugs are partial fulfillment is 24. They got some, they didn't get some. So the rest, they are still unattended. So it helps. This system can even help in queue management. We can even know how many people are in a queue and how long it takes to be in a queue. Go next. And another dashboard. This one is for. Now, this is the latest one that you have come up with for the hospitals. After we brought in what is called Facilities Improvement Fund, that is, hospitals can now expend money at source. So as we speak, 390 tenders have been floated, and 26 are pending to be approved by various people. That is the chief officer, the medical soup. 21 tenders are running. 48 have been rejected for one reason or another. And 41 tenders have been awarded, meaning those people should supply. So that way we can be able to monitor what's happening in our various hospitals. Go to the next one, is the fleet management. That one is for? Yes? Yes, now this is for maternal. If you get pregnant in Murang'a, we give you a small cash incentive to come to public hospitals. Yeah, we do not want home deliveries. So far, yes, we have stopped that program for now because we are doing some auditing on this program. But 10,000 mothers were registered to this system. 9,000 saw the doctors. 8,200 were paid. Now, per each sub-county, let's say like Kang'ata, we have 14 underage mothers. Madhya, we have 41. Keharu, we have 30. That way. I go to fleet management. This one is where we can track the movement of all county motor vehicles at any given time. And if we see you as a driver, you have entered into a bar, we can stop your vehicle at a click of a button. So on the left are all county motor vehicles. This is now the map where they are. You can see the ambulances there at a place called, I don't know where, that way. And it also helps us monitor drivers' behavior. On a weekly basis, we give them a report. We tell you whether you are overspeeding or you are not speeding. And that way, it incentivizes them to... yes? Oh, you can see here, in Naivasha. So if for any reason I'm out of the route that is indicated in the worksheet, we can just switch it off using this system. That way. And this other one is for... Yes, this is now our internal system. People used to queue at the finance office seeking various money. Hey, I want to travel, pay me this. So we tell them, no. We are creating a system. When you want to request money, you just go into the system, we'll pay you. So we have made so many. Let me reach there. But we see an opportunity in artificial intelligence where now all these systems will be in one system embedded, and therefore human interaction with the system will be low, and now machines will now be powering this system. Thank you.